We all know things are not created equally. Some brands are better than others, some products work, others don't. So how do you know if you're getting the right laser treatment? Wouldn't you want to pay for a service which will work? Dr. Dr Atwood joins us this morning to talk about laser technology and how you can make sure you're getting the right laser treatment for your problem. Dr. Atwood is with Arkansas Laser Solutions. They're one of our experts on 5newsonline.com. Good morning to you, Dr. Atwood. How's it going?
Great, Ashley. Good morning to you.
Glad to have you here. There are several different kinds of laser technology out there. So first thing, do all of them work?
Well, they all work to some degree. The important thing is, do they work effectively, and do they work with a downtime or recovery time that's easy on folks? And our emphasis at Arkansas Laser Solutions has been to try to offer people the most effective treatments that they can get from the lasers. And yet, of course, we do have to balance that with a recovery time that's compatible with most people's lifestyle.
Now, as we're talking about that, of course, when we're talking about lasers in general, there's so much different information out there about them. Some myths are out there as well. So what are some of the myths about lasers?
Well, I think the biggest myth is that they're akin to a magic wand and that you can pass a laser over something and it'll just automatically make it better. The truth is that they're a tool, an instrument, just like anything that we use in medicine. Some are better than others, but a lot of it depends on the skill of the operator and who's doing it. So that's why that we put so much emphasis at our facility on making sure that everybody is as trained as they can be, so that we get the best results that we can get with the tools that we use. Now, one of the things that I wanted to mention today are some of the technologies that we have available. And I get asked a lot about why don't we have a Fraxel laser, or a laser that uses fractionated pulses. That's been a big topic lately, and it's still somewhat of a controversial topic even among the physicians and the clinics that use the laser. So I wanted to talk about that a little bit. When the Fraxel laser first came out a few years ago, we looked hard at getting one of those because it was advertised that it was going to allow us to treat people with a much less downtime and with maybe even a better effect. Now that we're a few years down the road from using those kinds of lasers, the feedback that I get from pretty much everyone at the meetings that I go to is that the Fraxels work, but they don't work quite as well as we would like them to work. With the fractionated pulses, the idea is that we'd do spot treatments of different areas of the skin, but in between we'd leave areas of the skin that were untouched, and so that the healing would be a lot quicker, and yet we'd still see maybe some of the skin retraction that we wanted to see and so forth. But what we found out as time has gone by is that the quality of the result that you get is still not as good as what we can get with our ablative lasers that actually take off a little superficial layer of the skin completely. And the healing is really not that much quicker. And if you can't get that kind of better result, there's really not a good reason to invest the money in that kind of technology, because again, as far as we're concerned, it's all about the result that we get.
And like you said, a laser is not a magic wand, which is why you have to be educated and trained to be able to use one. So, of course, Dr. Atwood, you're sitting right next to Kevin Vicknair, also with Arkansas Laser Solutions. Tell me a little bit about the training, the skill, the education level that you at Arkansas Laser Solutions have to go through to be able to use the laser to get the results that you're trying to get.
Well, before I personally started using lasers many years ago, of course, we had to go to several courses and be able to see the effects of the laser and use it in monitored situations. But over time, the lasers have developed to the point that we don't have to treat people as deeply as we did, because when I used the laser, we used to have to put people to sleep in order to be able to do this. But now the laser can be used more superficially and yet be just as effective. And I'm real proud of what Kevin's done, and I'll just let him talk a little bit about all the training that he went through to be able to do what he does now.
So Kevin, tell us about your skill level.
Well, every year we go to as many conferences as we can, and to learn the new technologies that are out there and whether or not those new technologies work, as we're discussing today. The American Society for Laser Medicine and Surgery is the largest, most prestigious laser association there is in America today, and we've been members of that ever since we started into this business, and you know, that really isn't saying too much. Anyone can be a member. Ashley, you can be a member if you like. All you have to do is pay the dues. But the difference is we have gone and taken all their courses and have become a fellow of that association. You have to take so many courses. You have to attend all the meetings, take their tests, and you have to meet certain criteria to remain a fellow.
Well, because you don't want just anyone working on your face, your body, your legs without the proper certification. Now, tell us a little bit about what someone is interested in getting laser treatment done. Let's say they go to Arkansas Laser Solutions. What does the client or the prospective person need to ask to make sure whoever's going to be working on them is qualified?
That is a good question. Being in the state of Arkansas, there is really no qualification to use a laser. A grade school graduate, you don't even have to be a grade school graduate to use a laser in Arkansas. So the question is, who's going to use this laser on me? How long have they been doing it? How long have they been using that particular laser? Are they going to be seeing a doctor beforehand? That's very important. The state of Arkansas requires you to see a doctor beforehand. Those are the very minimal questions that everyone should ask before they schedule to be treated with a laser.
Best to be informed. Dr. Atwood, before we let you go, any last thing you'd like to mention?
We'll also get asked a lot about laser liposuction. If I can just put a plug in about that.
Go right on ahead.
That works too, but again, it doesn't work more effectively than the technologies that we've had that are easier and I think are, for the most part, less risky. So, you know, the companies have to push these products and they advertise a lot, and so people hear about them, but sometimes they don't get the whole story. So that's why we appreciate being able to be here today. Thank you.
Well, we thank you for being here. A plethora of information about lasers. Of course, Dr. Atwood and Kevin Vicknair both work with Arkansas Laser Solutions. Like we've mentioned, they're also one of our experts. So if you'd like to ask the expert, head to our website at 5newsonline.com. Click on the tab which says As Seen on 5. Then click on Ask the Expert. It's just that easy. You'll find a link on his Ask the Expert page, and you can email your questions to Kevin Vicknair and Dr. Atwood. They're located at East Joyce Boulevard in Fayetteville. There's their phone number, 479-443-9573. Dr. Atwood's office is also on Joyce Boulevard at 1794 Joyce. His number, 479-443-7771. Thank you both for being here. We've got more.
Ashley.
Thank you. We'll see you
Thank
again
you.
soon. More 5 Sunday Morning is coming up right after this.